Step 6, ovarian reserve. Okay, so when you're undergoing IVF treatment, you should find out your ovarian reserve, because it's very important, as it helps your specialist to formulate your individualized protocol for ovarian stimulation. So first I will explain what is ovarian reserve. So women are born with set number of eggs, and they cannot create new eggs as they get older. So they can only utilize eggs which are stored in their ovaries. So 25% of women born with low number of eggs, 50% of women born with average number of eggs, and 25% women born with high number of eggs. Depending on the level of your egg reserve at the time of birth, your fertility and the menopause follows that paths. So essentially, if you're born with a low number of eggs on your ovaries, you run out of egg reserve quickly and you become infertile, and you may have a diminished ovarian reserve, premature ovarian insufficiency, or early menopause. If you are born with a very high number of egg reserve, like if you have a PCOS, your fertility declines slowly and you have a late menopause. And if you have average egg reserve, then you lose your fertility approximately at the age of 45, 47. Then after a few years you have menopause. So when you're undergoing IVF, it's very important to know whether you have a high, medium, or low egg reserve. So you can do that by checking markers for the egg reserve. There are 4 markers for egg reserve: your age, your FSH level, your AMH level, your antral follicle count. So I will explain each marker individually. So on your ovaries, any given time, you have a multiple small follicles containing egg, which are called antral follicles. Any follicle which measures less than 1 centimeter on your ovaries are called antral follicles. These follicles contain egg, and some of them become large and you ovulate egg, and others disappear on their own. So any given time you have number of antral follicles, so you keep replenishing, you create new ones every day and lose the old ones, and you keep replenishing your egg reserve by creating antral follicles. And antral follicle is a very reliable marker of egg reserve because it's direct marker. So more antral follicles you have on your ovaries, the higher your egg reserve. For example, if you have a PCOS, your AFC is very high. You may have 40, 50 antral follicles at any given time. If your egg reserve is very low, your number of antral follicles are low. Really, you don't want to have a lower antral follicle than 3 or 4, which means you're really running out of egg reserve. Second marker is AMH. AMH and antral follicle count are mirror image of each other, because AMH is actually produced from antral follicles, from the surface of the antral follicles. If you have high AFC, you should have high AMH. For example, if your AFC is 20, your AMH should be approximately 20. So these are direct markers, and the level of this AMH and AFC reflects how many sleeping inactive eggs you have on your ovaries. So these are direct and reliable markers of egg reserve. And the third marker is FSH. So FSH is not direct marker because it's produced from pituitary gland in a response to ovarian activity. If you're really running out of antral follicle count, if you're not producing a lot of estradiol, if you don't have much ovarian activity, then your FSH increases gradually, but it's indirect marker. Also, you need to check FSH only at the beginning of your menstrual cycle. AMH and AFC you can measure any point of your menstrual cycle. So fourth marker is age. Generally, since you get older, your egg reserve declines. Your age can be used as a marker of your egg reserve. Generally, if you're older, you assume your egg reserve is lower, but it is not very accurate, because your age may be older but your egg reserve may be very high. For example, if you have a PCOS, even if your age is 40, you still have lots of eggs on your ovaries. So but still it is used as a marker for egg reserve. So generally we use AMH and AFC as a reliable markers for egg reserve before starting your IVF cycle. So now I will explain why it is important to know your AMH and AFC. For example, if 20 women undergoing IVF at the age of 34, if you don't check these markers, you assume these women have very similar egg reserve, and you may just give a standard dose of drugs to stimulate their ovaries. But when you check the AMH, you actually find out these women in 3 different categories. 5 of these women, which is 25%, have a very high egg reserve. These women have a PCOS. Then 10 of those women, 50% of these women, have average egg reserve, and 5 of these women have a very low egg reserve. Just doing simple AMH test, we can tell who has high, medium, or low egg reserve. So, and accordingly, before IVF treatment cycle, your specialist creates individualized protocol which takes your egg reserve into account to determine the dose of ovarian stimulation. For example, if you have a low egg reserve, then you need to have a higher dose of ovarian stimulation to push your ovaries harder so that you can produce good number of eggs. Quantity as well as quality of eggs you produce in IVF are the main factors which determines your success of IVF. So, and if you have a low AMH, low AFC, then you need to use a higher dose of ovarian stimulation drug. If you have average egg reserve, average AMH or AFC, then you should have average dose of ovarian stimulation. If you have a high egg reserve, if you have a PCOS, if you have high AMH, high antral follicle count, you need to use a lower dose of ovarian stimulation drug so that you avoid or reduce the risk of ovarian hyperstimulation syndrome and still get good number of eggs. So this is why before undergoing IVF, your specialist checks your AMH and antral follicle count, and they use this marker to estimate your egg reserve and to determine what dose of ovarian stimulation you need in IVF treatment.